There is a rule that is promulgated called Title VI that says that you can't discriminate on the basis of race if you're an institution that receives public funds. And these scholarships have been set up in order to give specifically students of certain races and ethnicities the opportunity to get these scholarships. Now, you're allowed to give scholarships for people that are needy. You're allowed to give scholarships for people that are particularly talented, something that goes above and beyond some immutable characteristic that they were born with. But these schools have opted to do this. Again, it's this idea that we're going to make up for past discrimination by present and future discrimination, something that, we at Do No Harm feel very strongly is un-American, and that is something that we need to combat. When one frankly says that we're going to give a scholarship to an individual because, not because of their race, but based on their race, their eligibility is based on their race. This clearly goes against, I think, the principles that we all think represent fairness. And unfortunately, there's a long history of this sort of thing in medicine that we thought had been eliminated. If you go back into the 1920s and 30s, it was Jews that were excluded and as a definite category. And there was an interesting study done several years ago where someone wrote to the medical schools of the various medical schools around the country, and they acknowledged the fact that they had limited the number of Jewish applicants that they would accept. So we totally reject this. We think that admission to medical school should be based on merit and merit alone, and that as there are plenty of African American students who are highly qualified and are worthy of admission to medical school, and they should be admitted to medical school if they so desire to enter medical school, but on the basis of the fact that they've achieved what they've achieved, not because of some desire to create some sort of quota system in medicine where every medical school class perfectly reflects the population of the United States. And even if one tries to do that, again, as you said, it ends up excluding many people, and typically South Asians and East Asian individuals are the ones who end up getting excluded. So again, this reflects Ibram Kendi's idea that in order to produce some sort of justification of past discrimination, we engage in current and future discrimination, and we at Do No Harm completely reject this idea. And that phrase, do no harm, is embedded in the Hippocratic Oath, the Hippocratic Oath that speaks about treating individual patients as individuals and not as members of a group. And we adopted that name because we think that best reflects what our goal is. Our goal is to prevent any harm from being done to patients in the name of racial equity and in the name of some sort of woke idea of what of power differentials between white people and Black people and nonsense like that. So we're rejecting discrimination, and we're rejecting any harms that may be done to the American populace because of these kinds of racist practices that are being performed currently in some institutions and are certainly proposed to be enhanced in the future. Hospitals are closing all around the country. They're in economic trouble. In Philadelphia, I think virtually every hospital in Philadelphia lost money in the last year, and that inevitably leads to scarcity of availability of services. So if we have a scarcity of availability of services and some rules based on race, then inevitably we're going to start to see differential treatments. Beyond that, I think it undermines trust that patients need to have in the healthcare system. You need to go to a physician and think that they're doing the best for you simply because of the medical problems that you have and not for any other reason. And I think the literature supports the fact that that's been the way things have been. There are disparities in health outcomes, but I think it's very clear from careful reading of the literature that these inevitably result from factors that patients bring with them to the hospital, maybe social conditions, but factors they bring with them to the hospital and not the nature of the care that they're receiving in the hospital or at the doctor's office. And so the concern I have is that trust will be undermined, and that ultimately that rationing could even be done based on race if these kinds of initiatives are left unchecked.